one important thing we have learned, like if some drug is having a loading dose, how we will write and where we will write. So the loading dose will be written in the once only section. Hello guys, my name is Faraz. We are here with the third video of our respiratory section, and this is the last video of the respiratory section video. So this type of the scenario will be given in your exam. There will be no heading. I have just given this heading for my convenience. Acute exacerbation of COPD, we are going to write a prescription, and here you can see you have to note down those 6 or 7 things which I am telling you in every video. You should be aware of the department where patient is. You should be aware of the patient details. You should be aware of the consultant detail. You should be aware what you are going to write. You should be aware about the diagnosis. You should be aware about the ongoing medication, and separately underline or encircle the PRN as required medication. And you should be aware of the allergic status and the allergy to the drugs and status, like what is the reaction to those drugs. So in this slide, let's start writing. So you are a resident doctor in the medicine. Mr. Holmes is the patient, 60-year-old, coming to the hospital with this problem, and patient was admitted in the ward. Diagnosis is acute exacerbation of the COPD. So you are going to prescribe the clarithromycin and the regular medication. So this is the main task. You are going to write the clarithromycin with the regular medication. So regular medications are over here. As I told you, in the regular medication, you should be aware which medications are the PRN medication. So Serotype 250 inhaler is BD. Salbutamol 100 mg, 100 microgram 1 to 2 puff 6 hourly is the PRN. Encircle this medication. Terbutaline 2 puff 6 hourly is the PRN. Encircle this medication as well. And tadalafil 2.5 mg per oral PRN for the erectile dysfunction. So this medication is PRN, but the PRN indication is the erectile dysfunction. Patient is admitted in the medical ward with acute exacerbation of the asthma. So I think there is no need to write this medication. You can simply skip this medication, because this medication is not needed while patient is admitted with the respiratory compromise. Okay, the other important thing is patient is allergic to both of the penicillin and the clarithromycin. He gets itching. So your consultant had advised you to write the clarithromycin, but patient is allergic to this. So what you have to do, write down the prescription for the above medication. So let's discuss, which we always do in our videos or in our lecture. So case discussion is, first of all, you have to do what you have to open the B and F on the infection control chapters. You should be aware of that, and I am pretty sure you will be aware of that. Like if someone is allergic to penicillin, we go for the clarithromycin, and if someone is allergic to clarithromycin and the penicillin both, we go for the doxycycline. But if you want to confirm from the B and F, you can open and read it if you want. Okay, it will be just waste of time. This is very simple to remember. Penicillin allergic, then give the clarithromycin, allergic to penicillin and clarithromycin, give the doxycycline. Okay, and please keep in mind doxycycline has a loading dose and the maintenance dose. So this is from the BNF. It is saying like you have to give oral. First line is the amoxi, clarithro and the doxycycline. We are talking about the oral today. I will not talk about the intravenous. And then you can say what is gonna happen. Acute exacerbation of the chronic obstructive pulmonary disease by mouth. Okay, we are using by mouth. So initially what you can do, as I told you previously, the doxycycline has the loading and the maintenance dose. So the loading dose will be initially 200 mg for 1 day, and then 100 mg for 4 days. So in this way you have to write. Okay, so the loading dose, as I told you in your very first video, we will write the loading dose in once only section, because that 200 mg of the doxycycline will be only once, just for 1 day, and from the next day we will go to the 100 mg only once a day. So let's move forward, and now we are going to write the prescription. The one important thing we have learned, like if some drug is having a loading dose, how we will write and where we will write. So the loading dose will be written in the once only section. So here we go, while we will start writing the prescription, and you are aware about that. Like in the first section, we have to do what we have to write the consultant detail, department details, and then we have to paste the patient sticker in over here. Allergic status, patient is allergic to penicillin and clarithromycin. You will write your name and then signature. Patient develop itching with the both of the drugs. You will write the exam exam date over here as well. And as the task of this medication is the doxycycline, and as I told you previously, we give the loading dose of the doxycycline 200 mg just once a day. And I told you as well, like you have to write the loading dose in once only section. So that's the reason we have written written the date of the drug, the exam date, and you will write the time, and the drug is doxycycline, and we are writing the doxycycline loading dose. That was the per oral 200 milligram. Then you will sign and put the bleep number over here. This is just once, just only for 1 day, and you will write the doxycycline for rest of the 4 days. That is 100 mg only, and you will write that in the antibiotics section. Here you can see doxycycline, and the dose is the 100 mg per oral. Start date is from the 2nd. So if your exam is on the 1st of the January, you will write the 1st of January for the loading dose, and from the next day you have to write what you have to write the regular dose, that is the just 100 milligram. So here you will write the second, the next date of your exam date, okay, and then you will write only for the 4 day, and you will cross the 5th day. This is very, very important. Please keep in mind, don't skip or don't do any mistake over here. Then you will write your name, and you will signature for the antibiotic. Your GMC number is very important, your bleep number, acute exacerbation of the COPD. If there is any other information you want to write, you can write over here as well. So in this way you will move forward, and then we are going to write about the regular medication. So again, the medical department, hospital name, consultant name, and then you will paste the patient sticker in this box. And then the regular medication was Serotype 250 Evohaler 1 puff inhaled, and the start date will be your exam date, and that was BD. You will tick on the morning and the evening box. Then you will do the signature, write your name and the bleep number, and rest of the medications were in the as required section. And the in as required section, medications were salbutamol, terbutaline, and the tadalafil. That was for the erectile dysfunction, and I have not written that in this because that's needed while patient is admitted in the hospital. Okay, so salbutamol is 200 microgram. Indication is shortness of breath. So dose is 1 to 2 puff of the 200 microgram. Don't skip this 200 microgram. Okay, route is inhaled 6 hourly. You can take maximum 8 puff. Your signature and your name, date, and the bleep number same. The second as required drug is terbutaline, and terbutaline you have to give 1 to 2 puff inhaled 6 hourly, maximum 8 puff in a day. Then your name and the signature, your date of the exam, and the bleep number. So that's very easy, and that's all about today's video, guys. So in this video we have discussed about the writing of the prescription medication, sorry, as required medication, which as required medication we can skip while patient is going to be admitted, and we have written the regular medication, and rest of the regular doses will be written in the separate section. If that is an antibiotic, it will go to antibiotic. If that is a regular medication, that will goes in the regular section. So thank you very much for watching the video. If you have any question, you can ask me in the comment box. Thank you.